Welcome to Innersight, Health Optimization with Rudy and Shaun.
Right, and we're off on our next podcast in the Innersight series. We're delving in a little bit deeper to one of the topics we've had before. So, yeah, Shaun, we've had iron as a previous topic.
Yes, so today we're going to discuss iron again, but in a slightly different context. So we had to get the specialist out again to help us with this one.
Yeah, so we've got a specialist actually not in Cape Town today, so we're beaming her in from the city of Bloemfontein, where it's just cold. Here in Cape Town, it's very cold and wet. So we've got Claire. She's a senior specialist physician at the University of the Free State, and she is a specialist on blood health and, more importantly, a specialist on iron deficiency. Hi, Claire. Good to have you here.
I said, hi. Thanks so much for inviting me. Is my sound coming through?
Yeah, no, it's great. Thank you. Sorry about that. It's maybe a little bit of a gremlin in the air there. So, yeah, so the reason why we're talking to you is on our screening and our Innersight assessments, we've got a lot of athletes, and obviously it's people at the higher end of their health that want to know, but how can I get better? And a lot of them are athletes, and we pick up in a lot of them that there's problems with their iron. And I think that's probably something that you see a lot of, and I've heard a lecture you gave on iron in the athlete, and it's probably interesting how you got to know so much about that.
So my daughter was a swimmer, and until she got a shoulder injury, and I just, was listening to all these things that her coach used to tell her, and absolute, lots of truth and a lot of garbage as well. And as I was already fascinated with iron deficiency, it just made me think, but, we hear all this advice and all these things. My daughter was a high-performance swimmer, represented the country, and I kept thinking, but nobody's talking to her about iron. And that's actually how I started my journey with iron in athletes, because I had an athlete at home who just, would eat us out of house and home, do everything that she needed to do in terms of, all her supplements and monitoring her performance, and nobody was talking to her about iron. And so I started reading about iron and thinking, but gosh, surely this is a big deal for an athlete. And yeah, so that's how my journey started. And I remember when I first started, everybody looked at me a little bit blankly and thought, but, these are like the super healthy people. And why am I concerned about iron deficiency in that group? And when I started reading, I realized that actually this is a really big deal in this group.
And I think that is exactly why we've got you here, because that's exactly what we still get. And I mean, we are like you. We want to scream from the top of mountains like, this is the base of the pyramid. So this is not genetic testing or anything. People are getting that piece wrong. And it actually, when someone has as a limitation at their top end, they actually only realize, okay, but there's something more I can do. But that means the whole of the population are also struggling with that. And I think maybe I'm going to take you back in that journey to see how you actually got, because I mean, our ferritin is probably what we need to talk about. And I think when me and Shaun were in the same class, and when we at med school, I didn't even really know the word ferritin. And I think that's probably what we need to start with as a base, is ferritin, that people can understand what that is.
And Claire, the other thing is that what we see often is people will come in and then they said, yes, but they got tested and it was normal. And then when we actually look at the labs, we can say confidently that it's not normal. And I think that message still need to get out there, that how do you test for iron? Let's start at the beginning, the simple steps, and take it from there.
Yeah. So you mentioned med school, and I think that is one of the biggest problems, is what we were taught about iron in med school, and also what we weren't taught about iron in med school. So, we all exited med school knowing how to manage, super complicated conditions, but I mean, if we're really honest with ourselves, how many lectures did we even get about how to manage the common cold? And I can confidently say I'd never had one. And I think it's very much the same with iron deficiency. And, you know, often I start my talk saying that the most common nutritional deficiency in the world is iron deficiency. And yet, sort of conversation point is asking doctors, but how do we identify iron deficiency? And we still get it wrong. You know, and it doesn't matter which audience you ask the question to on how to diagnose iron deficiency, we still get it wrong. It's sort of a bit comforting because they've done loads of studies elsewhere, and it seems like it's a global problem. People don't know how to identify iron deficiency. And I think the first problem or hurdle that we need to get over is that most people only start screening for iron deficiency once the hemoglobin is low. And I mean, by the time your hemoglobin is low, it's true, probably you've got iron deficiency. But if you look specifically in an athlete, but in anybody else as well, by the time your hemoglobin is low, you've been iron deficient for so long that now finally you have become anemic. But iron is a crucial metal that is needed for so much more than just hemoglobin. So the first myth that we need to bust is that I only screen for iron deficiency once my hemoglobin is low. The second myth that we need to bust is the so-called morphologic approach to anemia. So in other words, I'm only going to screen my iron or my ferritin when my MCV is below 80. Because, you know, in med school, we all got taught, you know, if your HB is low, the next step is going, what is my MCV? Is it big, is it small, is it normal? So if it's small, okay, well, then we're going to screen for iron deficiency. And the point is, by the time your MCV is low, you know, you've really, that person is so depleted of iron. And, you know, yes, they probably are iron deficient. But what could I have done so much earlier? So my soapbox moment is to say we need to think about it long before this patient is anemic and long before the MCV is low. The third point is the labs get it wrong, and I don't know why. So the laboratory reference values are a major challenge, and especially for a busy, whether it's a GP, a physician, it actually doesn't matter what specialist it is. Most people cannot know the nitty-gritty about every little reference value. And what happens is you just look for the flag, H for high, no flag or an L. And in a busy practice, you are only going to respond to an H or an L. So whether this value is high or low. So if the laboratory fails to flag something as high or low, you are probably going to overlook it, no matter how good you are, because you trust the lab, don't you? Or you think, oh, I heard that lecture long ago and this woman carried on about a 30 or she carried on about a 50. But this is now a 19 and the lab didn't say anything. So maybe they're just using a different instrument. And that is one of the things that worries me a lot. So this is now the person that's maybe decided, well, we're not going to wait for the MCV to be low. We're not going to wait for the HB to be low. Let's check the ferritin. Now the ferritin comes back as, let's say, 21. And there's no flag. So the GP or whoever's looking after this patient believes that this patient is fine. And we need to get to know our reference values if we want to seriously delve into treating iron deficiency.
Thanks, Claire. I agree so much. And I'm going to come back to that one a little bit later. I want to bring our athletes into this and maybe ask you, an athlete, what will they feel? Because, I mean, it might be something like when they're in menopause, it's not the test, but what that you always feel as an athlete, what will they feel? How does it look in an athlete's mind or in their body? What will they feel in the day?
So there's a really nice study where they looked at iron deficiency and the symptoms of iron deficiency. This study was done specifically in women, but it is the most recent data that we've got. So almost 100% of people with iron deficiency, and that's non-anemic iron deficiency, have got fatigue. So, and how that will manifest in the athlete is, they're just not performing quite the way that they wanted to perform. They are tired. And a lot of people will say they've just sort of got mummy brain or they're just a bit foggy. these are symptoms of iron deficiency: shortness of breath, not reaching my optimal VO2 max, even as an athlete. But other people are really just much softer symptoms. They might be anxious, they might be depressed, they might be sad, not motivated for this very sport that they love. And they've lost their love for the sport, which for me would be the biggest loss of all, is to see somebody lose their sport. So the neurocognitive functions of iron deficiency absolutely cannot be overstated. And I think in a sportsman where your big match temperament and, getting yourself ready is really big. So that's another place. But then, your skin can become dry, you might bruise easily. There's lots and lots and lots of things that long before, and you'll notice that I never use the word pale. So nobody's going to say, well, this person's looking a bit pale. Yes, they will become pale. But long before that, the patient will have other complaints, which are much softer complaints that people might say, oh, we'll take a Serdep, just rest a bit. You haven't rested enough. You're overtraining.
I also think that when people look at athletes, they think, oh, but they've got their diet dialed in, they should be fine. But obviously, there's other reasons why they might be low. I mean, they've probably got a higher need of iron than the general population as well, and lose more than the general population.
So yes, athletes generally follow a really good diet. So I know that some of the people that are listening are athletes themselves, and I'm going to try and explain hepcidin to a general population. But so yes, in good health, we absorb about 1 milligram of iron. So if we eat enough iron, we will absorb sufficient iron. Now, the paradox with being an athlete is that there's this hormone called hepcidin that gets released when your body is stressed. Now, being an endurance athlete, while being, something that makes all your friends very impressed with you, puts your body under stress. So now your body will release more hepcidin. And what hepcidin does, it blocks your iron absorption, which is counterproductive, isn't it? So now, because I have got this low-grade inflammation from having my big run or whatever sport it is that I was doing, now the release of hepcidin, no matter how much good iron I'm eating, no matter how much, whether I'm taking an iron supplement, yes or no, I've blocked the absorption of that iron. And that's one of the biggest reasons why athletes become iron deficient. It's not because they're not eating properly. Yes, they don't. A lot of them don't eat properly, especially in weight-sensitive sports, like ballet dancers, gymnasts, that sort of weight-sensitive sports. They don't eat nicely because of they need to not eat too much. But athletes also do lose blood. If you think of an endurance athlete, a lot of them get small bleeds in the gastrointestinal tract, often because of anti-inflammatories that they take, or just because they were running, and that by itself causes little bleeds. They get what in the olden days they used to call it march hemolysis, which from marching, from soldiers banging their feet on the ground, but it's very much the same in a comrades athlete. They get, it's now called foot strike hemolysis. So, you bump your feet on the tar long enough, you're crushing your little red blood cells there. So yes, it's a whole spectrum of why do we get iron deficiency. So even in the face of plenty, I can become iron deficient. I hope that answered the question.
No, I think that's a very important message. That it even if your diet is dialed in, that you can still have a deficiency in iron. So we said that they might have some inflammation on board, and that's blocking the absorption of the iron. Will you pick it up in your bloods like a raised CRP, or is it not associated necessarily?
So I don't like speaking something that I don't have data to support my comments on. And I don't think that nothing comes to mind that athletes have got a raised CRP. I know that there's data that says that athletes have got a raised hepcidin, which, is a surrogate marker then for inflammation. But yeah, so I don't know that you'd pick it up with a CRP. And the hepcidin is a very, you can't just request the hepcidin from the lab. It's generally a blood test that is done in a research environment. There's, very little clinical use for it.
So,
I love that, Claire, and I want to bring it back to the to our listeners. That's why we've got Claire here. She only speaking the science. This is exactly why we've got you here. You're not going to answer yes, maybe, maybe not. You're saying the CRP doesn't really lead us here, so. And I think maybe with that CRP lead, I want to maybe come back to say we should then maybe tell our listeners why they need to have at least a yearly ferritin and what they need to have with it so that they can ask their doctor for the tests that they should have.
You have to. Anybody who is serious about this sport has to have at least an annual ferritin. So. And there's actually guidelines that state that there are some athletes that need to have ferritins done even more than annually, because you know it depends on which cycle and what type of training that you're doing. But at the very least, you need to be testing your ferritin annually, more frequently if you're a woman. So if you're a woman, you need to check, and a woman athlete, not just every woman, but if you're a female athlete, you are really at risk of iron deficiency. So you need to be testing your ferritin at least every 6 months. But we must be careful how we test our ferritin and how we test our iron studies. And do you mind if I go into that and the tricky things about testing there, or do you want?
I think you need to tell the athlete what they need to tell their doctor, because their doctor will tell them their HB is fine and then the iron is fine, and it's not true. I think for the lady out there, let's say 35 years old, want to run a marathon, what do they need to ask their GP to show them?
So the 35-year-old marathon lady needs to be testing her ferritin every 6 months. But there are T's and C's when you test your ferritin. So the first is you do not need to have an abnormal hemoglobin or anything abnormal on your full blood count. You need to test it, whatever your full blood count says, you need to do the ferritin. So that's the first step. The second step is, when do I do my ferritin? So ferritin is an acute phase reactant. So what does that mean? It means that if I have got inflammation, or I'm sick at all, or if I've just run a big race, which, like we said earlier, is an inflammatory process, your ferritin goes up. So don't think, okay, well, next time I go to my doctor with my cold, or, maybe I had a bladder infection or whatever it is that takes me to the doctor. Don't tell your doctor, oh, now's a good time. I am seeing you now. Let me do my ferritin. No. Your ferritin must be taken while you are well. So that's the first step. It's not a convenient thing that while I was seeing my doctor for my common cold. No, you must be well. The second thing is that ferritin is often interpreted in the context of other iron studies. So like a transferrin saturation is the one test that is often done with, usually done with a ferritin. And the transferrin saturation can be affected by the multivitamin or iron supplement that you took that morning. So you should preferably take your iron test when you are fasted, and the other multivitamins. The last thing about the ferritin is that you should not take it sort of mid-cycle while you are frantically training, because then you are also already quite inflamed, even if it's a chronic inflammation and you're not feeling anything, but your body is taking its strain. So you should ideally be testing your ferritin right at the beginning of your exercise cycle, and not sort of the Monday after the comrades.
That's such good advice that you gave there. I love it.
And I think it's so important. I mean, and both me and you and Shaun have gotten onto this. I mean, I started with this journey very much like you, with my wife struggling to ride up a hill with a bicycle, and then started digging, and we found ferritin, and her ferritin level was 14 at the time, but normal HB. And since Vernon's talk, I've started testing my kids 6 monthly, and it's almost impossible to get a kid, even on a good supplement, to get them above a ferritin of 100. And maybe we should talk about a level of a ferritin that you see as okay for an athlete, because I think it's different for the normal population and an athlete.
So that is very, very important, is what is normal. So before I said, I like to function within the realm of good data. And unfortunately, here it's going to be functioning in the realm of good opinions and not good data. So that's my disclaimer. So I think it doesn't matter what your laboratory says. It's safe to say that if your ferritin is less than 50, whether you're a couch potato or a comrades marathon, if your ferritin is less than 50, you are iron deficient, full stop. So that applies to everybody. So, but then that area between 50 and 100 is sort of a little bit of a uncomfortable area where, and most people actually say that your ferritin should be up into at least 100. Specifically, if you think of the pleiotropic effects of iron, and maybe we must even talk about why is iron such a big deal, and it's not just about the hemoglobin. So we want to make sure that your iron stores are full, and we definitely would like it closer up to 100 and not as low as we can possibly go. So, but the data supports a 50.
We've got that. And I think what we should also tell people, the reason why you get those symptoms early is because the marrow is such a glut for iron to try and keep you going with an HB. So, and you said once your HB has fallen, the body's been sucked dry of iron. Am I getting this correct?
Yeah, no, absolutely. So generally we tell our students that iron deficiency happens in 4 stages. So the last stage is when my hemoglobin drops. The second last stage is when my MCV starts dropping. In the third stage, my bone marrow iron stores are actually dropping. And in the first stage, often I've just got these funny little symptoms. My hair's falling out. I'm a bit more moody than my usual self. And so it's basically asymptomatic, but my ferritin is already low. Yeah.
So the symptoms that you explained there, that's all energy related. And I think maybe we can just touch on that, why, those symptoms and how the iron fits into the energy production. Maybe people will understand why you get all these funny symptoms before your HB falls.
Yeah. So, yes, iron is very important to make hemoglobin. And hemoglobin is the biggest, if you think of where iron goes in your body, hemoglobin is by far the most important place where iron is used. And obviously, your red cells do carry oxygen, so having enough hemoglobin means that I can carry enough oxygen, from my respiration down to my muscle. So yes, that is the biggest component of the energy cycle. But what we often overlook is the role of iron in the mitochondria. So the mitochondria for the athletes is the powerhouse of the cell. And without a mitochondria that works, you can take as much, performance enhancing whatever as you like. You are not going to turn whatever that is, no matter how good your diet was, no matter how many vitamins you took, you're never going to turn what you put into energy, because the mitochondria is important to make ATP. And that is your energy. It's important for growth. And when we speak about growth, I'm not meaning in length, but just in maintaining my muscle mass and my bone mass as well. And then obviously that then translates into your energy. So we can't enter the aerobic cycle of metabolism without iron, because that is entirely dependent on iron. So you need iron to make energy. But the other place that we often overlook and where iron is important is there's a protein that sounds just like hemoglobin, and that is myoglobin. So myoglobin is your muscles, and you cannot make good muscles without iron. So your muscles are going to become sore, they're going to become tired, they're just not going to do what you want them to do, no matter how hard you train. And often that also is why we become exhausted. But beyond just your skeletal muscles, the ones that we see and that we're working out, there are other muscles that you're not working out. But although you might be working out without realizing it, and that's your respiratory muscles. So your intercostal muscles, your diaphragm, those are also muscles that are highly dependent on iron, just like any other muscle. So this is part of the reason why people start to get tired. And they've done great studies actually in older people, looking at their respiratory function when they're iron deficient, fixing up just their iron deficiency and how much better their respiratory function is. So why can't that be true for an athlete as well? I think that you could apply that there, because you're highly dependent on good quality breathing as an athlete. Well, I'm thinking of my daughter as a swimmer. Breathing is a big deal there. So that's, I think, the biggest reasons why iron is important in energy beyond just hemoglobin.
I think we did a podcast on creatine about 2 or 3 months ago, and we talked about iron being, energy being used, and ATP being as the currency of energy in your body. But for our listeners, this is one step before creatine even, is to make that ATP, because the creatine is carrying that phosphate between ADP and ATP. But to make the ATP, you need iron. And that's what you're saying. It's even lower in your pyramid of feeding is iron, and it is so important for females, but then especially your female athletes. And I think what you just said, it just brings it home that there's so many places that it's working, and Insight started with, we want to shout this from the mountaintops that people should have this tested, and you think that people will know this, but I mean, we had a lady that actually works with iron the other day in our offices, and she didn't know about the ferritin having to be tested every 6 months. So we need to get the message out there.
Claire, I want to step back again. You mentioned that with the athletes and the low grade inflammation they might have, that it's possible that they don't absorb the iron. Is there any advice that you can think of how do we overcome this?
So I think the first thing is that, it's back to screening. Every athlete must know their ferritin. So, and because there are 2 ways to look at this thing. So the one is, yes, I probably need to take a supplement. And then we'll talk about when to take my supplement. And then the second is a supplement ever even going to work for me? Am I not the type of athlete that actually needs to get intravenous iron? And is this not a place that we need to start exploring more, is who are the athletes that no amount of supplements is ever going to work for? So we need to start by knowing our ferritin. And I want to tell you, at my last iron talk, one of my friends, he's also a doctor, and I'm not going to say what specialty is because he's from a small specialty, and he listened with intent and he gave me a hard time, and he went home and the next day checked his ferritin and it was 7. And he is a high performance athlete. So don't think that just because you're a doctor that you are exempt from getting iron deficiency. And importantly, don't think that because you are a man that you are exempt from getting iron deficiency. And don't think because you're a healthy man that you are exempt. It follows athletes like a shadow. Okay, so we need to screen. Then we need to take, obviously, a proper diet. But I think that that's a talk all by itself. When do I take my supplement, and which supplements should I take? So the first is maybe the easier question to answer, is when to take my supplement. So there's data in athletes to show that actually, straight after, which is counterintuitive, but that's what the data says. So straight after my exercise, that's when I should be taking my whatever supplement it is that I chose to take. So not in the evening, not before I train. So go and train, come home, have your orange juice and drink whatever iron it is that you have chosen for yourself or that your doctor has advised you to take. There are different iron formulations on the market, and I think that that's a talk that would take more than 2 hours to go through. But I just want to warn you that in general, we advise against enteric-coated iron tablets. They cost a whole lot more, and there's zero benefit from taking an enteric-coated iron because you just sort of miss the whole place where the iron is absorbed. side effects of oral iron is a problem for some people, and that is something where I think that we need to listen to our patients and listen to our bodies. And if you do feel nauseous, which is the most common complication of oral iron, I think that then you need to see, well, can I tolerate it, or can I change to maybe another iron formulation that doesn't cause nausea as much? And then, and if I can't tolerate that either, then you're definitely moving into the realm of somebody who needs to get parenteral iron or intravenous iron. I hope I answered the question. It felt a bit convoluted.
Yeah, no, you have. And I think we've also ended up, we now run an iron infusion clinic in the northern suburbs of Cape Town, because we realize that supplementation is quite an issue, and our medical aides in South Africa will then, if you've been on an iron oral supplement for 3 months and you're not getting the levels correct, that's the next thing the athletes then need to go, and that's not okay to leave it there. You need to then tell your doctor to motivate for IV iron, so that you can get the iron in the vein and bypass this gut that's causing you problems or not absorbing correctly.
And the only way we can know that is by actually testing. So we go back again to, you need to know your numbers.
Mm-hmm. So that can't be overstated, and I think that we mustn't ignore the inflammation, and not keep blaming ourselves. Well, maybe I didn't take my iron properly, maybe I should have taken it every other day. But we must acknowledge that even in a super fit athlete, there is a degree of inflammation that makes it difficult for oral iron to always work. And we should have a low threshold. I'm talking to the clinicians now, but we should have a low threshold to turn a patient over onto parenteral iron. There was actually a study that showed that but this is now in the context of being anemic, but that if you are anemic and your oral iron doesn't work within 4 weeks, it's unlikely ever going to work. So I think that we need to start challenging the funders as well. Why should somebody struggle for 3 months on an oral iron if it hasn't, it's not going to work? But that's also a talk for another day. But yeah.
Oh, that's amazing. This is the second time I've heard you talk about iron. The first time was at the Iron Academy, and then I listened to you speak about iron on a webinar, and I am so grateful that you've shared this again. I think the athletes out there, it's enough for them to know that they need to know their numbers. I think that is where they need to start. And I think for our colleagues out there to listen, to say, okay, but there is something you can do about this. It is. Yeah.
Absolutely. And I mean, there's so many athletes that, they just reach that plateau in their program. They can't get that to that next step. And it might just be the iron.
Absolutely. And I think that if we start looking, as doctors, I actually think that that's one of the reasons why the funders get anxious when we do talks like this, because when we start looking, you've got to take action. There's no point in testing somebody's iron or their ferritin and finding it to be low, and then giving them oral iron, let's say for argument's sake, and not testing it again. So that's my second sort of soapbox moment, is to say, yes, you must know your numbers. But the second is as important, is that what if I took my oral iron or even parenteral iron for that matter, did I check again to make sure it worked? Because one thing that is true is that bad things happen to good athletes as well. And we can't just assume that all iron deficiency in athletes is because of inflammation. We can't just assume that it's, little GI bleeds or, maybe poor diet, and all these things are true. This is the reason why most athletes become iron deficient, is because of the physiology around their exercise. But a good athlete can also get a colon cancer. A good athlete can also get any luminal malignancy that can cause bleeding. And I think that is sort of the sobering moment. we can all give as much iron as we like, but we are not only looking after an athlete, we're looking after a patient. And if that patient does not show an adequate response, despite compliance and despite all the things that we tell them to, take it with an orange juice, take it straight after training, and that iron or ferritin doesn't pick up, you are obliged to look a little bit deeper.
I agree 100% there, Claire, and that's so important that you stated that. We can't just put a little plaster on the wound. We need to go ask the question why, and that's such an important point.
So I'm gonna maybe just before we finish, I just want to summarize for our athletes out there. So it's all athletes, not just women, but definitely women 6 monthly. But our athletes need to have their ferritin level tested. If it's low, you can trust it. If it's mid-range or high, you need other information. And then they need to act on it and have it retested, because your iron level fluctuates. It's not something that's going to be there all the time at a normal level. So they need a 6 monthly or yearly ferritins. And I think for our colleagues out there, you need to test the ferritin. And then also, if you for our athletes, if you have any of these symptoms that we said, maybe test your whole family, because maybe your whole family's diet has got something in there that you're not getting enough iron in. Because I think we're getting these little pearls every time we do a podcast, and my pearl here today for me was like, a retest, and don't think it's just a athlete. Retest and go and do a screening of the colon and the gut. And the pearl for me when Vernon was talking was, if your daughter's maths points are dropping, go look and look for the ferritin. And yeah, thank you so much. This is amazing. I love this.
Yeah, I think the message is clear, and you took like a academic subject, and you use the word dumb it down a little bit, so for the average person to understand this subject, and the message is clear. Thanks a lot for doing that today.
It's a huge big pleasure, and I think each one must test one, and we need to start by testing ourselves and knowing our own numbers. Thank you so much for inviting me. I really enjoyed being here.
And your education is working. You've definitely educated, sorry, I've tapped the mic there. They've definitely educated 2 people that are living what you said in a few talks. So whatever you're doing, keep doing it. We love it. And thank you so much.
Thank you. Thank you very much. Goodbye.
Bye-bye.
Thank you.
Disclaimer. This podcast is not intended as a substitute for the advice of your healthcare provider. No doctor-patient relationship has been formed through this podcast. The content here is for information purposes only.